right. So I'm going to say good morning, everybody, because it's early in the morning here in Washington, D.C., where Dr. Beth Cameron and I are located at the moment. And I have no idea where everybody else in the world is tuning in from. So whatever time of the day it is, good morning, good night, good afternoon. This is the Global Health Security Network webinar. This is the third webinar in the series since launching the network. And it is my pleasure to have with us today Dr. Beth Cameron. I was trying to figure out exactly how long we've known each other, and I can't actually figure it out. About 15 years, I think, something like that.
At least 15.
Something like that. So I'm lucky to count Beth as a colleague and, more importantly, a friend, and really delighted that she's willing to join us today to talk a bit about biosecurity, particularly biosecurity in the age of COVID. And I'm going to actually ask her to start by telling you a little bit about her career, because we've all come to this space of global health security from such different places, and which means there's no actually defined career path for how to do this. But which is one of the reasons I would love to have Beth actually talk you through how she went from a bench scientist through the AAAS program, like how she ended up at the White House, basically running pandemic preparedness and biodefense for the Obama administration, to what she's doing now. So with that, let me actually welcome Beth to the webinar and ask her to give us her the 3-minute speech on your entire career.
No challenge too big or small. And first, thanks, Rebecca, and thanks everyone for tuning in. I'm delighted to be here today, and Rebecca is world expert, and I'm delighted to have the chance to talk to you today and to get your questions and answers. So think of some hard ones. You have a chance to stump us both today. So Rebecca's quite right. There's no real specific way into health security. And I think that's one of the things that's so exciting about this network, to be able to bring some more rigor into the field and to make it more clear to people like me who are interested in this field and who didn't actually know that we were interested in this field. So I started as a biologist. I was a PhD in molecular biology and human genetics while the Human Genome Project was going on. And I was really interested in cancer research, and I thought that that would be my career. But as I was graduating and getting my PhD, I was thinking about other interests that I had. And I had a longstanding interest in ethics and policy, looking at things like stem cell research and cloning experiments that had really just at that point begun to be possible. And so I took a fellowship, which in the United States, there's a program, and in some other countries as well, to bring scientists into government through the people that publish Science Magazine, the American Association for the Advancement of Science. So I took an opportunity to work in Capitol Hill for a year, and then following that to work at the State Department. And the year that I went to work at the State Department was the year that the United States launched its President's Emergency Action Plan for AIDS Relief, PEPFAR. And interestingly, that did not mean that I got to work on global health. I wanted to work on global health. I wanted to learn about global health, but they hadn't decided where the funding was going to go yet. So I was interviewing, and nobody could offer me a position in global health. And I ended up in an office at the State Department that works on cooperative threat reduction. And what they were doing at the time was working with scientists that had weapons experience in order to redirect them into peaceful research, including peaceful biological research. So they were interested in a biological scientist who could help with that work. Some of the programs were cancer-related work. And so I thought it would be interesting. I'd taken Russian in college, and I thought I would do it for 1 to 2 years, and I loved it. I really enjoyed working at this interface of health and security, thinking about international security, thinking about building peaceful coalitions in research. And I stayed at State for 7 years, went on to do similar work at the Pentagon, and then ultimately got detailed to the White House in 2013, where I had the intense honor of working on the global health security agenda with people like Rebecca and many of you tuning in around the world who either worked on that or maybe are still working on it, in order to further bring the communities together to think about how we actually measure progress and really to accelerate political will to be prepared for any kind of biological event. So that's the 3-minute, the short version. But the piece that I'd like to emphasize is, what I really wanted to do was work at this interface of health and policy, and I was able to do it. I just had to figure out how to get there and how to make those opportunities happen along the way. And so even though I came in through one route, I ended up working with the people and in global health in the way that I wanted to. And so I just encourage everyone to keep your eyes open for different opportunities and ways to get to the ultimate destination, and to be open to new destinations, because there might be one that you don't even know about.
Yeah, I think it's fair to say that many of us had what can only be described as the accidental careers to get to where we are. But let me take us now to the present, and maybe you can tell us a little bit about, like, what are you doing? What is your current job, and the kind of the portfolio of work that you're focused on?
Yeah, I'm now an organization called the Nuclear Threat Initiative, which has always focused on catastrophic biological and nuclear risks. And I'm currently, we like to work with governments around the world, as well as private sector and non-governmental experts, in order to make global change. So we're interested in measurable change. And our program is interested in measurable change to reduce the likelihood of a globally catastrophic biological event. So we're focused not only on naturally occurring emerging infectious diseases like the pandemic that we're all currently experiencing, but we're also really interested in the possibility of something that might be worse or might be different, an accidental biological release, or a deliberate biological event from a terror. And so our programs are focused on in 4 different dimensions. One, we're looking at engaging governments to bring consensus that biosafety and biosecurity are really important pieces of global health security. 2, we're interested in working with private sector actors who are creating technology for good purposes, for purposes of building a more sustainable world, for health security, environmental security, and food security, but also recognizing that technologies come with risk. And we might actually accidentally, or if a nefarious actor is doing something intentionally, misuse a technology which could actually cause that same catastrophic event that we want to prevent. And so we're working with the private sector, particularly with companies, with organizations like the World Economic Forum, in order to invest in biosafety and biosecurity and try to build it in as new technologies are being developed. The third area that we're focused on is measuring progress, and our organization works with the Johns Hopkins Center for Health Security and the Economist Intelligence Unit to produce a 195-country global health security index, which builds on the WHO joint external evaluations, adds in additional indicators, and measures progress, ideally every 2 years, on how countries are doing on epidemic and pandemic preparedness. And then finally, we are very focused on globally catastrophic biological risks, building the community of leaders that care about these issues, the community of the next generation, like you, and trying to really spark interest in order to get ahead of the next potentially catastrophic event.
So let me actually jump on that last area. And so I kind of watch from the side, and I've been watching you and your amazing team the last couple of years start the series of dialogues and engagements around the world. And what I was hoping you'd do is talk to us a little bit about the Biosecurity Dialogue program that you've been working on, and how exactly you have been engaging and kind of engaging with partners around the world and governments, and advancing this space within areas that hadn't really focused on it that much before.
Thanks for asking this question. I want to give a shout out to my colleague Haley Severance and Catherine Budesky, who might be watching and have been part of the Next Generation Network, who are really helping lead this effort on my team. So the Global Biosecurity Dialogue was launched, and we have been really fortunate to have great support from the Government of Canada's Global Partnership Program, as well as the Open Philanthropy Project for this work. We built it in order to inform 2 streams of work. One is the Global Partnership, which is a coalition of countries that are focused on cooperative threat reduction. So programs that are focused on reducing nuclear, chemical, biological, and radiological risks. and specifically the biosecurity portion of that group. And that's a group of governments. And so we wanted to create a space for countries to speak in a more sort of off the record way about emerging biological risks and gaps and barriers to building capacity to reduce accidental and intentional risks, as well as naturally occurring risks. So we built a space that would feed into that governmental group, which sometimes has trouble coming to consensus about how to collectively act or to act in a way that might be more impactful. We also wanted to feed into the global health security agenda. And so the Global Biosecurity Dialogue is officially in service of the Global Health Security Agenda Action Package on biosafety and biosecurity. When I left government, I really felt like the action packages could benefit from some infusion of non-governmental work. That something we could do in civil society was really bring bandwidth and leadership into those groups to help governments that are often too overwhelmed to be able to come up with creative ways to move the needle. So there are a lot of barriers in biosafety and biosecurity. Funding is one of them, but another really important gap is just the ability to focus on this area when there are so many other things that are right in front of a country on any given day, that thinking about the potential of an accidental or deliberate event seems far off. And so we need to bring attention to that issue, but we also really need to help. And so through the Global Biosecurity Dialogue, we wanted to find ways to bring countries together around specific questions and streams of work that we could help to emphasize this and build political will.
So let me ask you really like a process question, because that sounds great. And you're like, yes, and we inserted it as a work program into the GHSA action package. How does that actually happen? I mean, I think what we have are researchers around the world and people who are engaged and committed and often struggle with how to kind of translate the work that they are doing into action, particularly into it, it being picked up by government or governments. And I think it would be really instructive just to explain, like, how do you come up with this idea of like, we're going to do a set of dialogues and we found some funding and now it's going to become an official part of an action pack. Like, those are connections that don't always make sense to people.
So what I would say is you can do a lot if you have a good idea and a consensus and then are able to access somebody to champion your idea. So in this case, just really specifically what we did is we built, so the Nuclear Threat Initiative has a history of convening government. So we're sitting in a perch where what we do is we bring experts from academia, from the private sector together with governments. And we do that frequently, but that's something that's not unique to NTI. That's done by lots of civil society actors around the world. We came up with the idea. We looked at the action package on biosafety and biosecurity, which was functioning, which I knew was functioning because of my work in government, which we also knew was struggling to have leadership each year, to have someone that actually had time to invest in it because governments are busy. And so we went to the head of the action package, and the head of the action package when we were starting the Global Biosecurity Dialogue was the government of the Netherlands. And we asked the governmental representative from the Netherlands whether, and it was Mark van Passel, many of you know him, he's a great leader in the Global Health Security Agenda. And we talked it through with Mark about how we could work with the action package, present this as an offer to the governments in the group, explain what it was that we could do, how we weren't trying to act as a government, but we would act like a secretariat, actually, to be able to help with note-taking as well, to do the hard work, as well as to infuse ideas into the conversation. And so as the action packages were being, the terms of reference were being developed over the last couple of years, we offered ourselves as a secretariat. And part of that job was also being able to hold these dialogues and infusing ideas into the action package. So that part really came by convening a meeting, inviting people from the action package, putting ideas on the table, taking their ideas and feeding them into the discussion, and then being able to show value over time that these dialogues did create a space for people within their own countries to have conversations with leaders that are sometimes more challenging to have, and for them to raise their work up into the governments that they're in their own countries. And a good example of this, we have great participation from next generation leaders in countries around the world in our dialogue. Uganda is a place that's a great example where we have strong participation in the GHSA, strong participation in the action package, and then great participation from next generation leaders in that work. And I know that we might talk a little bit later about the competition and how that fits in. So I'm happy to save that for later.
All right, well, we might end with that.
Okay.
So, but let me ask, I mean, we're in the middle of a pandemic. So I think we can, it doesn't mean that other things are less important, but I think the question that we're asking of ourselves, of every one of our projects right now is, you know, how do we leverage them, and how do we build off of them as part of the COVID response for recovery, for the future? And sometimes we don't, right? And sometimes we're like, no, this other thing is so important that we can't take our eye off the ball while we are also doing this other thing. We can walk and chew gum at the same time, as we like to say. So I guess the question is, you know, are you using this platform as part of the response, or is this something that is just continuing as we think about what the future threats might be, and how are you balancing this?
Great question. And I think it's one that everyone is asking. How can we be relevant? How can we utilize our work, which is focused on preventing, detecting, and responding to the very thing that is happening to us right now, the global COVID-19 pandemic? So we were fortunate with the Global Biosecurity Dialogue to have a really strong partner before the pandemic in the African Centers for Disease Control and Prevention. And the Africa CDC is a continent-wide effort to build national public health capability on the whole continent. And there are 5 regional centers associated with the Africa CDC across the continent. One of the outcomes of the Global Biosecurity Dialogue was that the African CDC and the African Union launched an initiative to strengthen biosafety and biosecurity. And the idea there was that they would build biosafety and biosecurity into their IHR implementation program. So they had official, agreement from the African Union in their strategic plan to focus on laboratory capacity building and National Public Health Institute capability building. And what we said is that through the funding that we have from the Government of Canada and the Open Philanthropy Project, we would help provide information convening power for the regional centers of Africa CDC to focus on biosafety and biosecurity as part of their strategy to implement the IHR. And that we used the biosecurity dialogue and a meeting that we held around the world, but in Addis Ababa, as a way for that conversation to really take root within the African Union. So that happened before COVID. When COVID-19 hit, we had several workshops that were planned with regional centers that were to focus on biosafety and biosecurity in general, and to help build that capability into the national action plans for health security that the regional centers were working on with countries in their regions. And we said, okay, it's not possible for us to travel. It's not possible for us to really think in an ethereal way about biosafety and biosecurity. We need to be focused on what's in front of us. And so my team, working with CDC, the US Centers for Disease Control, working with the Defense Threat Reduction Agency, working with, obviously, first and foremost, Africa CDC, developed instead a series of trainings focused on how to improve biosafety in laboratories working with COVID-19 samples, and how to build biosecurity prevention measures, transport security, material control and accountability for COVID-19 samples. So in short, we took existing workshops and we pivoted them to focus on what was in front of the continent at the moment. And that was obviously informed and developed from Africa CDC leadership in the regions. And that was particularly focused in East Africa, and it's still ongoing.
So let me ask, I'm gonna jump around a little bit, because you mentioned some of my favorite words, and with the caveat that Beth and I have some ongoing just dialogue, sometimes robust dialogue around these things. But I'm really curious what you think, given what we've been seeing in this pandemic. What do you think the tools of global governance are going to be going forward? I mean, I think there's a question specifically around, the existing tools that we have, including the IHR, including GHSA, and then also if there's also an ongoing dialogue around what else do we need? And I'm very curious what you think would be what else do we need specifically for biosecurity and maybe even for biotechnology, but also without forgetting, like, what do we do about the existing tools? So I know I'm throwing a lot at you, but I'm hoping you could kind of talk to some of it.
I would expect nothing less. No, it's a great question. The first thing I would say is I think it's good to be having conversations about these issues. And I also think it's good for everyone to see, Rebecca and I don't have, we don't have all the answers. We don't know exactly what the right way forward is to improve the infrastructure that we have around the world for dealing with pandemic threats, whether they're naturally occurring, deliberately caused, or accidentally released. But what we do know is that we need to be thinking about that now. And so I encourage everyone who's watching to be thinking about the architecture that you want to see. It's not something that'll happen overnight. But we are at a pivotal moment right now where we need to be thinking big about what we need in order to prevent this from happening again or something worse. So to get to the specific question of types of things we might need, I think for sure we need to focus on the things we have been focusing on, biosafety and biosecurity in laboratory settings. But I think we also need to be aware that some of that work is focused on a specific set of agents, and those agents are important. We know that terrorists have been interested in those agents, and we've seen terrorist attacks being perpetrated with agents like anthrax. So it's quite important to protect those agents. It's important to know who works with them. It's important to have transport security. But it's also really important to think about what's coming down the pike. So DNA synthesis is becoming easier, it's becoming cheaper, it's becoming faster. That's a really good thing for making vaccines, but it also could cause a non-state actor or a state to do something bad with biology, to include creating an agent that might actually evade our current medical countermeasure system. So we really want to build biosafety and biosecurity into technology development. Right now, there's kind of a crack in the architecture. There's a seam, I would say, a gap, not really a crack. And the architecture that we have is, of course, we have the Biological Weapons Convention, which is focused on deliberate biological events. And we have the WHO, which is focused on naturally occurring biological events. And both of those entities are looking at each other, and they're both looking at emerging technology. But there isn't really one place in the international system that is looking at emerging biotechnology risks or bringing the private sector into the equation to talk about how to build safer and more secure technology, or how to think about the risks that those technologies can cause and how to better respond and detect those events when they occur. And so one of the things that we've put out there, our organization, is the idea that we might consider an entity. It could be within an existing UN system. It could be something new that is focused on emerging biotechnology risks, but also on norms and best practices in reducing risks associated with advances in technology. And we've had some conversations with the World Economic Forum. We've had conversations with DNA synthesis providers, where many of them are screening DNA orders, so that if somebody orders somebody orders an agent and their customers are actually being screened, the DNA is being screened. But many small companies are disincentivized from doing screening of DNA synthesis orders because it's expensive, and it's becoming an increasing share of the profit margin because synthesis is becoming cheaper, and it's cheaper to buy DNA. And so all of these things speak to what we don't need is an architecture where governments say, this is what we must do, and that's only what happens. We need the private sector at the table. We need the research funders at the table. We need government research funders, but we need philanthropies that are funding research to be thinking about all of the risks that we face from biology, deliberate and accidental, as well as naturally occurring. That conversation is starting to pivot, but it's still slow, as you know.
Yeah, and I think this field has not often been very good at engaging the private sector.
Very true.
And I think that's, clearly what you were describing, the private sector is so integral to the overall system. And we're also seeing the role that the private sector is playing in response. But I don't know. I mean, maybe that's a question for everybody listening on, what are the great new ideas, and how do we effectively engage with the private sector in ways where they are, they are part of the process and not kind of govern.
Yeah. I would love to see, and I would love ideas that come out of this network for sure. We need innovative ideas, people who are actually at the cutting edge of developing and using new technologies, and many of you are, to be thinking about how can we prevent, the next generation deliberate or accidental event. And one thing that I think we've been thinking about a little bit is, what would a biotechnology funders compact look like? If you were applying for a grant, as a researcher, and a funder who was giving you a grant to develop or use a new technology had in place sort of a set of things that you would have to do, what would you want to have on that list? What would you want to have? What kind of oversight do you think that we need to have in laboratories and laboratory settings around the world for developing and using new technology? And how can we incentivize funders of research to build that into grant applications?
So would that function kind of like an IRB, like it's not like a treaty enforced type of thing, but something that just relates to your ability to do research or publish, or if you write the paper, you have to say what was your IRB number?
Exactly. So I think there's generally speaking two schools of thought in how to reduce biological risks, especially biotechnology related risks. One is generally that there needs to be regulations, that the government should put in place laws. And laws are good, but laws are slow and they don't always keep up with advances in tech, especially if they're really specific laws. The second school of thought is that there should be a culture of responsibility that's built within a laboratory setting. Super important. We need to have scientists who largely want to do good work paying attention to risks. But neither of those two things are enough in my view. And they're also, I would like to see a creative solution where we're actually building the idea of risk mitigation into something that it's part of the research system. So into the process, into the biosafety committee process that oversees biosafety and biosecurity related risks, building in research oversight into that process as part of that discussion with principal investigators. Grant applications, including how are you managing risk from the time that you think about this research with, for example, a dangerous pathogen, or if you're working on influenza, how are you managing risk? And then by the time it gets to publication, we're not sort of asking publishers, stop publication. The publishers are saying, okay, this is what was done. And I either think that it was acceptable or they didn't do it at all. And I'm going to ask a bunch of questions. Bottom line, we need to make it part of the existing process that researchers are part of. Not more than culture of responsibility, but not just the government's coming in and saying, thou shalt do.
Okay.
What do you think?
No. I love it. I love the ideas, and I like throwing out we need new ideas. I don't know if everything's going to work, but I think we need to actually be exploring things and figuring out, and we need to be studying them. I think this is in creating kind of the evidence base for what works and what doesn't. So I love it.
We need some pilot projects for sure.
Right. With like a real M&E system attached to it.
Absolutely true. And yep, go ahead.
No, okay.
I was just going to say, I mean, think about what a good housekeeping seal of approval would look like for biosecurity. If you're a laboratory or a research group and you want to tell people that you are doing a great job with biosafety and biosecurity, in addition to the types of things that you have in place for accrediting your lab, what do you want to see that tells you that you are paying attention to these types of risks and that you're working with other peer groups around the world that are paying attention? And we're thinking about piloting sort of a seal of approval for biosafety and biosecurity, and not we, NTI. That's something that research groups should pilot together in different regions of the world. So what would that look like? That's something I'd be really interested in what this group thinks about.
And there might be a lot of parallels with the ongoing dialogue around material transfer agreements and how do we make that part of like the culture of the work that we do, and some interesting parallels with those conversations.
I completely agree.
Let me switch gears a little bit. I'm seeing we have a whole bunch of questions that are starting to come in, and encourage folks to keep them coming. There are a couple of things I want to make sure that I ask Beth. So and ask her a few more questions before we switch to the questions from the audience, I guess. It's very odd to say audience when everybody's around the world and you can't see them. Let me ask, well, first, we started talking about it a little bit, but I want to make sure that, and while you're describing this, I'm actually going to close the window because the light's coming in and there's some weird shining on me.
The sun came out in DC this morning. It got really bright.
Right. But you mentioned briefly a competition. I want to make sure that you have a chance to describe to everybody what it is, what this competition is. It's not the first year you're doing this, but what the call is for engaging researchers around the world, and how we then celebrate that. So while I close the window, if you could tell everybody a little bit about the competition.
Yeah, absolutely. So we're really excited at NTI to work with the Next Generation Global Health Security Network. And we've been doing this for I think this is our 4th competition now, to incentivize researchers around the world to work together and to work across regions with each other to build a network of next generation global health security interested people to focus on deliberate and accidental biological events as an important part of the global health security agenda. And so the Next Generation competition that we're launching this year is asking for papers that bring together next generation experts and professionals from different parts of the world to ask the very specific question about what kinds of actions could or should be taken to reduce accidental and deliberate risks during COVID-19. So we focused this year's competition on COVID-19 and the types of biosafety and biosecurity measures that might be related to it now and in the future, as we think about the fact that COVID-19 is here. It's here to stay, and even when we get to an equitably distributed vaccine, we're still going to have COVID-19 in labs around the world being studied, and the potential for it to emerge again. So that's the focus of the competition. And we do produce a prize every year. Usually our prize is travel. This year we are hoping that it will be travel to the Thailand Global Health Security Agenda Ministerial this fall. If for some reason that event isn't able to be held because of COVID-19, there will be an alternate prize. And in the past, we've funded teams to go to Global Health Security Agenda Ministerials or the Biological Weapons Convention meetings of states parties. So the goal is to build a cadre of interested next generation professionals in this specific piece of health security. But to do it, I encourage you that if you apply, that you work with professionals who are not in your region and not in your country in order to build, to further build the network of interest in this issue.
Oh, and this is and how do people find out more? Where do they go?
Okay, so you can go to our website, nti.org, and what I'm gonna do is drop the actual link into the chat once we get to questions. Sorry, I didn't have it sitting here where I thought it was. So I will drop it into will everyone see the chat feature? Or no, can't do that.
You know what we can do? We can make sure that the link gets posted on the website for the Global Health Security Network too.
That would be.
Just want to make sure we got that plug in.
Thank you. No, I appreciate it. And I definitely encourage questions to be asked to my team. And in the link, there's a place where you can ask Catherine Budesky on my team, who oversees this competition, any question that you have.
Awesome. So that's what I want to do right now is switch and start taking some of the questions that are coming in from folks around the world. And then we'll come back around, and I got a couple more questions for you directly, but let me first start going through these. So I'm going to take them in order here, and the first one comes from first let me apologize if I mispronounce your name. I mispronounce my own name and my children's name, so so I'm doing the best I can. But Akansha, hopefully I got that right, from New Delhi, who has a question around, if I can summarize this, the question of like, what do we know about offensive biological weapons? And how much of a threat do you think that is? How much threat do you think the offensive BW is for, within militaries? And I think that just really your thoughts on where the kind of status of things are as we think about how we prioritize this threat next to all the other ones.
Yeah, happy to answer that question. Also happy for you to jump in on that as well, Rebecca, as you're an expert on this issue and have gone to most of biological weapons conventions meetings over probably the past 20 or 25 years. So my view is obviously it's hard to know exactly what countries' intent is with biology. And biology is challenging because there are so many positive uses of biology. It's very hard to figure out what a country intends to do with biological capability. What we do know is that biological capability in emerging technologies are making it easier to do catastrophically bad things with biology. Also incredibly good things that will lead to, ideally, health security, environmental security, food security, sustainable development in general. And so I'm quite worried about the potential for states to use offensive biological weapons in the future. I'm also quite worried about the possibility that a state could experiment with a biological weapon and accidentally release it. I think that's also a challenge, especially now that it's becoming easier to make agents more transmissible and more virulent. I think the other thing that we're missing, and that's been really hard in the BWC context, is to build transparency between countries. I'm worried about the fragmented and disorganized world that we're living in, where we're having it hard to have conversations with countries. I think right now the political dialogue, and with the disastrous decision of the United States to withdraw from the World Health Organization, those kinds of actions aren't making it easier to have conversations with countries about really tough issues, like the potential for a country to develop an offensive biological weapons program. And I think researchers play a critical role. I think that researchers are going to be key to developing a culture where biological research is shared, where there are conversations that are transparent about the intent of specific biological experiments or biological research projects around the world. And I think trust is essential in building the world that we want to live in, where countries aren't developing or using biological weapons. But when countries aren't speaking to one another, when our UN Security Council system breaks down, when the UN system doesn't function the way that it should, which is imperfect, it's always going to be imperfect with over 195 countries and member states, but even in that imperfect situation, it allows for a space where countries can actually talk about really tough and challenging problems. And so to answer your question, I do think it's a problem. I think it's certainly countries have been assessed to have biological weapons programs, and the biological weapons programs that existed in the past have been large and capable of wreaking mass destruction. And so I'm quite worried about the future for biological weapons to be developed and used. And I want this generation of researchers to really be thinking about how to prevent that from happening, both technologically, but also from a geopolitical standpoint.
Well, and that kind of feeds into, I'm going to go with Paul's question next, which is, given the challenges that you just brought up in multilateral fora at the moment, how do we actually get to a point where we can have more standardization in handling biosecurity threats, particularly in both the developed and in low-income countries? And how do we kind of create those norms when the dialogue in Geneva is so fraught at the moment?
It's a great question. So I think first and foremost, the institutions we have are important. So it's really important to support the Biological Weapons Convention and the World Health Organization and the international health regulations. They're imperfect. We need to strengthen them. We need to examine them. We need to create new mechanisms within them. But losing them, getting them back would be really hard, and they are the institutions that we have. So that's first. But I also think that some creative work needs to be done that can be led by researchers, that can be led by coalitions of researchers on different continents, that can be led by the private sector. So I would like to see an organization that focuses on norms and standards for dual-use biological research and emerging biotechnology risk. I'd like to see that emerge because I think it would be great to have the private sector and researchers involved from the ground up in examining what kinds of experiments might we not want to do, or might we want to do in a way that has a specific set of norms associated with them. And I think that that conversation might actually also foster some additional transparency that could feed into the BWC, for example. I also think it's really important to think about some of the really tough conversations we've had just bluntly right now with the allegations that have been out there about COVID-19. COVID-19 is a naturally occurring biological event by all accounts, but there's been a lot of discussion about what's the origin of COVID-19. And what that's caused many of us to think about, and probably many of you have thought about this if you're interested in this topic, is what is the right approach to determining the origin of a virus in the middle of a catastrophic event? And I think it's really important that we have a depoliticized way to do that, that is internationally led, that is more than a public health investigation, but less than a biological weapons investigation. Something that says, look, we don't actually know what the viral origin is. We're not sure if it's a bat. We're not sure if that's to pangolins. Some people are saying it's an accidental biological release. What's the way to have that conversation so that for all the good of humanity, we can learn as much as possible about the origin? And I think that's something that going forward, we need to think about, but it's going to be really challenging, especially in a situation where countries are throwing rocks at one another.
So let me actually follow up on that a little bit, because yes, I think the challenge is actually how do you do that? I mean, there have been a bunch of proposals that have been put forward. There was the Australia proposals, just the discussion from World Health Assembly. We're seeing proposals for an entirely new standalone entity that would be able to do investigations. Do you have an opinion on what you think is best at this point?
I have a couple of opinions, but I'm also interested in what you think. So
oh no, it's not. I'm not on the hot seat today. It's you.
So one of the things that I think we both think, because we both published an article about this last year or the year before, I think for sure that there should be a person within the Office of the Secretary General who has an accountability role for high consequence biological events. High consequence biological events of unknown origin, where, with a focus on something that might be deliberate or accidental, but where you don't know, because what we do know is that you probably won't know on day one exactly what happened, or there might be confusion around it for lots of reasons. So I believe that would have been helpful for COVID-19 in holding all countries to account. It would have been helpful to have that person in place to talk through some of these tough issues associated with allegations about viral origin on all sides. But I also do think that the UN Secretary General's mechanism for investigation of alleged use of a chemical or biological attack which, by the way, rolls off the tongue. Right off the tongue. It requires a country to challenge, to say, I think there was a deliberate event. And I think that's a step that you might not want to take if there's a lot of confusion around what happened, even if there's evidence to support a deliberate biological attack. And so I do think that we need another mechanism. I'm not sure if it's something that could just be built onto the public health investigation that we already have, which the World Health Organization leads, or if it's something of a hybrid, where there's someone in the Office of the Secretary General who's looking at high consequence events that works with the WHO, or whether it's also possible that this can't involve WHO, because WHO needs to be focused on the public health matters at hand and separate from the politics of any kind of investigation of that type I'm on the fence about it, to be honest. And I'd love your view. I'd also love views from anybody asking questions.
Well, I'm gonna hold off on my view for a little bit because I don't want to derail the conversation. But I think to me, it's one of the more it's a critical question that we're going to have to sort through as we think about what governance looks like going forward. And I think that there's a lot of the calls for standalone new entities don't take into account if you create another UN agency, then you still have the same challenges of a member state organization, and how do we actually think, and if you don't make it a member state organization, then do you want to empower an entity to be able to come into your territory? So I think there's a lot of issues to work through.
Yeah, and I'm not sure that we need an organization for that. We need to think about what the mechanism is and which existing UN entities need to be part of it. We also really importantly have to think about how it would be called for. Who calls for that? How does that happen? And how can that happen in a way that ensures that the investigation is actually likely to occur and get to answers that everyone would want? So I think there's a lot of questions to be asked. Where I am right now is I think we absolutely need a mechanism that addresses this in-between place between a public health investigation and an alleged use of a chemical or biological attack. But I don't know exactly who and how, and I think that's a really important conversation for governments and civil society to have.
Well, let me broaden the aperture a little bit and take a question actually from Ryan, who is a student at Georgetown who actually works with my research team. And he's asking about the political barriers to early detection of future emerging infectious disease outbreaks. So I'm wondering if you have any thoughts about how do we strengthen our ability to do early detection, let alone, we're not even at the investigation point, but those first indications that there's going to be something coming about so we can actually take early action.
Yeah, this is a critical question. Thanks for asking it. I wish I had a perfect answer to this question. I think it's a question that most people in this field are asking, because this obviously was an essential component for COVID-19, learning as quickly as possible, and learning not only when it emerged as quickly as possible, but where it went, and where and in which states in our own individual countries we were seeing outbreaks. So I think there's several components to it. There's obviously the information sharing component, which has been much discussed in the context of the international health regulations, and the need for transparent information sharing as quickly as possible, even information sharing where it's unclear what's happening, where their data is unclear. And I think that's one challenge for this community, is how to share information that's imperfect, how to share and when to share information, the importance of sharing information that isn't going to tell us exactly what to do, and where we're not actually sure what we're seeing or what we're saying, and knowing that there are ramifications maybe for sharing that information, but making sure that we build incentives into our system for sharing that information. So I think there's been a lot of conversation about how quickly information was shared from China when COVID-19 originally emerged. There's also a lot of questions about how and when countries around the world learned in their own countries about the emerging outbreak. And there's also a technical component here. What kind of disease information sharing system do we want? And we've watched around the world, I think, in many of our countries, probably all of our countries, different systems for managing information from around the world and from within our own countries be built. In the United States, a lot of that work has been done in the academic community, including at institutions like Georgetown and Johns Hopkins, Harvard and Columbia and University of Nebraska. All over the country, there are new systems being built for information management, because we found that our own data management systems that we had in place before the pandemic were not as robust as we had hoped that they would be for managing an all 50 state emergency. Importantly, from a policy perspective, I don't think that we also have had, and this probably applies to the IHR, but Rebecca, you can correct me, triggers for action are still relatively squishy. So we might have data about what's actually emerging and what's happening in our countries or in our states. But understanding from a policy perspective what that means, when we should consider taking actions that have enormous economic and human consequences, that's really hard. I have a colleague at the Center for Global Development, Jeremy Kanindijk, who's been talking about the famine warning system as a model. You know, what is the alert system that tells us that an emerging infectious disease outbreak starting to look unusual? And is there a system that we could create in the future that could be a hybrid of government and civil society that could inform governments around the world to be able to take specific actions, and what kinds of triggers do we want for those actions to be taken? So there's a lot of work to be done, I think, and I think it does feed into examining the international health regulations and what happens at different stages of learning about an emerging infectious disease outbreak. So Ryan, I have a very imperfect answer to your really excellent question. But keep asking it, because I think it's probably one of the most important questions coming out of this pandemic that we can ask.
Well, let me ask a quick follow-up on that. I think, you know, one of the other pieces on that is how do we do a better job of integrating the, you know, from a One Health perspective, you know, how do we track and make sense of viruses in animals and their potential for species jump? And I don't know if you have any thoughts on or suggestions on ways that we could do a better job on that front.
Yeah, I mean, it's critical. It's, you know, emerging infectious disease outbreaks are increasingly coming from animals, and spillover is hugely important, and it was hugely important in this outbreak. So I do think that it's true that including in forums like the Global Health Security Agenda, including the work that is built around the joint external evaluations, while there was all intent, having been there for many of those discussions at the beginning, there was all intent to build in One Health approaches, to build in a focus on spillover. Still not enough has been done on that front by any stretch. And so I think we really do need to do a better job of looking holistically at how emerging infectious outbreaks are likely to manifest themselves, how spillover is likely to happen, and to build programs that are comprehensive. I do think that many of the programs, at least the assistance programs that are funded by the US government, those two approaches are still somewhat siloed. And I think that that we still have a lot of work to do to bring in particularly the veterinary component and the environmental component into global health security. So I encourage any of you focusing on that in the network. I think that's still a really important issue. And I will take the opportunity to say just one personal view, which is we often lump it all in to the One Health approach. And that is a really important concept in term, and it's done a lot for the community. But I think that it also sometimes becomes a buzzword, like health security itself can become a buzzword. So I encourage you to explain, when you talk about One Health, exactly why it's so important. When you explain it the way Rebecca just did, spillover from animals to humans as one example, people living in closer proximity to animals, focusing on what's circulating in animals and understanding it and what could be jumping into people. I think that begins to tell people what they can do about it and why it's important. And that is part of a One Health approach. But we also have to be able to understand exactly what interventions we want to take to actually improve.
And then we'll just throw in climate change and every other environmental challenge that we're facing and how that impacts our diseases as well.
Well, hugely important. Hugely important.
Yeah. So there's another question here from Henning, and it's on the Global Health Security Index. And, you know, the index, the JEEs, a lot of the metrics that we've been using and looking at the last few years haven't necessarily correlated well with national capacity to respond to COVID. And maybe I'd like to give you the opportunity to comment on this. Again, this is something that we've discussed in detail as well, but to comment on what you think. The question here is what went wrong with the index and what indicators are missing. But let me throw to you to answer that.
No, it's an awesome question. So, you know, for sure, the United States is the most prepared country in the index, and we have one of, if not the worst, responses around the world. So absolutely, true. The index was not meant to be predictive of what a country would do. It was predictive of what capacity we have. So a couple things I would say. The first is that there were some warnings in the index, including our low scores in public confidence in government, some of our scores around political and security risks, other areas where the United States did not do, as well as other countries. Access to healthcare is another area where we did very poorly. And I think our community health system really needs a reboot. And I think we can really see that now that we have not focused enough on that. And we got a flat B, which I would not call a good score. And we did not color the United States in green on the map for a reason, because we did not think that what we saw was prepared. That said, we've been convening our international panel of experts for the index over the last couple of months. And we've had a number of exciting conversations with experts around the world about what's missing from the index, and also how can we take some of those leadership indicators, those indicators that tell you how might a government use the capability it has, or in the case of the United States, our federal government has not taken advantage of all of the capability that we do have. Certainly there were some capabilities we need to strengthen, or that flatly we weren't prepared for. But there's also a lot of capability, a ton of capability, in fact, that we left on the table. We did not muster a unified federal response. We did not use what we had. And so we're trying to think about ways in the index to apply some of those indicators in a way that would weight them differently across the categories, to think about how important those factors have been for countries around the world, but particularly the United States and the United Kingdom. There were, however, I will say, a number of countries, Thailand is a great example, that did extraordinarily well. South Korea also in the top tier of the index. Many of the countries in the top tier actually did very well in correlation with their index scores. But at the end of the day, the country has to use the capacities and the capabilities that they have. So great question. Stay tuned. We're planning to release the next index next fall. And we'll also, when the index is released, you'll be able to look at the data from the previous index through the lens of the new weighting and indicators. So it'll be interesting from a research perspective to look at that and to look at it in relation to COVID-19.
Can I just clarify, fall 21 or fall 20?
Fall of 21, sorry.
Okay.
Fall of 21. We're beginning research. It's 195 countries, so it takes a little bit of time. Sorry, did I say this year? I meant next year.
Excellent.
It feels like this.
So we're actually
shout out to Jessica Bell, who is our leader for that effort. And I think many of you probably know her as another person who's participated in the network in the past.
So we're actually coming up, we've got about 2 minutes left in the hour. And I want to make sure, I know. And I want to make sure that I give you kind of one more opportunity to, if there's anything we haven't talked about that you want a chance to discuss. We haven't even talked about the project we're working on right now.
No, I'll do that in the last couple of minutes. So Rebecca and I, so Georgetown Global Health Science and Security Center, the Center for Global Development, and NTI have been collaborating on a project called COVID Local. COVIDlocal.org is the website. And it includes a bunch of tools related to the COVID response. One of those tools is targeted at the international community, and particularly at low income and low and middle income countries. And the idea is to be able for decision makers and state and local governments to be able to run through a checklist of capabilities and be able to think about what needs to be in place to deal with a pandemic event like COVID-19. We also have a set of metrics which are focused on social distancing and how to think about relaxing and contracting social contact depending on where you are in the outbreak. And that's something that we've talked about a lot, to get a unifying set of metrics, particularly important in the US right now where there's so many cases and where we haven't expanded social distancing in a unified way. And that's leading to a large amount of resurgence in many of our states right now. We also have a really exciting new feature that has been released, and more will be added to it, called COVID AMP, which Rebecca and her team have really been the driving forces for. And it's looking at the relationship between policies and what's happening with COVID-19 in the outbreak, and has a huge power of a database that Georgetown students and researchers are creating and maintaining to look at how effective policies have actually been at different phases the outbreak. So I'm super excited because it has great potential for research, and it has great potential for the future, to tell decision makers what types of policies are actually going to be effective at managing the outbreak and improving our capabilities. So stay tuned, and we look forward to your feedback. There's a feature there to give us your feedback, so please definitely do that. It's being manned by our teams. And thank you.
Thank you for that. It's a project we're really excited about, and I think feeds into a lot of our collective work to actually try to build the evidence base in global health security at the same time that we're trying to solve the problems of today. So so with that, I know we're at the end of the hour. I wanted to, first of all, apologies if we didn't get to your question. We'll try to we'll work with Bex and figure out how to make sure we can get answers to you. I want to remind everybody to stay tuned for announcements for the next Global Health Security Network webinar, which I believe will be the end of this month, as well as some announcements will be coming on the plans for the next Global Health Security Conference. With that, please, I don't know how you join me, but I want to thank Beth for her time, for her thoughts, and for sharing herself with us this morning to talk about some of these really important issues. So thank you so much. And I don't know, we probably have about 6 more Zooms together today. So we got to go back to work but really, again, appreciate the opportunity to be able to have you speak with everybody today. And I'm just delighted that you're part of this community.
Thanks so much for having this community. I think it's critically important. Thanks for the great questions. I'm excited to be in the network and look forward to interacting with all of you. Please stay safe and healthy, and thanks for all the work that you're doing.
Bye, everybody.